Would you believe that I went all the way to China to interview an endocrinologist? No? Well, I wouldn't believe that either. Would you believe I interviewed him over the phone? Well, you should believe that because that's exactly what I did. Vladmir Carvalho is an endocrinologist who's been following my channel, and I began to notice his comments, which were always positive, underneath my videos. I got curious about him, and the video you're going to see is my interview with him about the best treatment for diabetes. Before we go to the interview, I want to announce that Benedict and I have scheduled another mission to Nigeria in March 2020. As always, we appreciate the prayers of our friends and any donations they'd like to make toward covering our budget for this outreach. We'll be preaching the gospel, teaching believers the fundamentals of Christianity, providing a free medical clinic, and ministering to the local orphans. For more information about this mission or to donate to help us cover our budget, see the link in the description below. Well, ladies and gentlemen, I am excited to talk to a man from a long distance. I guess this might be the farthest distance I've done on any interview. I did one friend from India, and this man is in China. In fact, he is staying up late. It's 1 a.m. where he is. It's 11 a.m. where I am, and his is the next day. So his name is Dr. Vladmir. Pronounce your last name for us.
Carvalho.
Yes. So welcome to Beat Diabetes, Dr. Vladmir, and thank you for staying up so late to be on this interview.
And thank you so much as well for having me here.
Okay. Well, it's our privilege. You're actually the first doctor that I have interviewed, and you are... and you're also the first person I've interviewed from China. So you're setting some new standards here for our interviews, and I'm excited. I got to know Dr. Vladmir as a result of him making comments in our videos, which is the way I get to know most people. You know, if you don't comment, I don't know you exist. But when you start commenting, then I read those comments and I learn about you. And when I see the doctor before the name, I get interested because some doctors don't agree with the approach that I recommend. Others do. Dr. Vladmir, you're not a diabetic yourself, is that right?
No, I'm not.
But you are an endocrinologist, and whenever you talk to people about diabetes, they often will say, my endocrinologist told me this, or my endocrinologist told me that. So let's just start out, doctor, by telling us what is an endocrinologist and how is the field of endocrinology related to diabetes?
An endocrinologist is someone that deals with disease of the endocrine system. And in our body, we have different glands that produce hormones. And those hormones are supposed to go to different places in our body, in different cells, to tell them what to do. And one of those glands, one of those hormone producing place is the pancreas that we all know. And because the pancreas produces insulin, that is the main regulator of blood glucose. Anytime you see someone with high blood glucose, they will refer that person to an endocrinologist, simply because pancreas is an endocrine organ. Well, it actually has two functions, an exocrine and an endocrine part of the pancreas, and we deal with that one. So that's why they might call us when someone has high blood sugar.
Right. And so the endocrinologists are, people that study and are expert in the area of how glands release hormones, and the pancreas is obviously a gland that releases the hormone of insulin. I would imagine, tell me if I'm wrong, but I would imagine that because there's so much diabetes all over the world that talking and working with diabetics is a big part of the life of an endocrinologist. Is that correct?
It's actually most of it. unless you decide to specialize in something else. But in general, in the hospital, most patients are diabetics.
Yeah. So, Doctor, you are an interesting fellow. You didn't start out in China. You don't look like a Chinese person. You actually started out in a place called Cape Verde. I had to look that up to figure out where in the world is Cape Verde. Turns out it's an island off the coast of Africa. So, how in the world did you go from there to China? And were you always interested in endocrinology? I mean, when you were a little 10-year-old boy, did you say to your mama, I want to be an endocrinologist? How did you to get from there to where you are now as an endocrinologist?
No, it's not that I wanted to be an endocrinologist, but I wanted to study medicine. And at that time, I didn't even know that you have endocrinology inside medicine. So when I started studying medicine and then later saw that, people with diabetes is because of this and that, and then start understanding a little bit about diabetes, I decided to study it more because of mainly two reasons. The first one is that now a lot of people are having diabetes. And the second reason is that in my family, a lot of people have died with diabetes or, been amputated before or some things like that. For example, when I was young, when I was a little boy, I don't even remember what age, maybe 5 or 6, my great-grandmother was amputated. They cut her leg when I was that young, and I didn't know why. But later, with understanding, now I know what's going on. And I can tell you that I will not have type 2 diabetes. But if I didn't do this, maybe I would just accept my destiny and would have it.
Yeah, so that is very powerful to hear where you come from and how you are motivated. Let's talk about the idea of doctors in general and endocrinologists in particular and their attitude toward diabetes. A lot of people on our channel that make comments are not particularly happy with doctors because some of them hold to the old school idea of you must eat lots of carbs every day, lots of carbs at every meal, 50 grams, 75 grams of carbs per meal. And they seem resistant to the idea of restricting carbs. But you obviously don't feel that way. I mean, I got to learn of you because of the positive comments you were making about my videos. Tell us, is there a change going on among doctors and endocrinologists about how diabetics need to restrict carbs? What about your professors? What are they teaching you about these things?
I think it might be different in different places, but saying that diabetics must eat a certain amount of carbs I think the first time I saw it, I felt like it was a little bit strange, but I don't know if it's because of where I'm studying and and my professor. He is so into diabetes education and diabetes self-management and things like that. And in the hospital, at least where I had my training, I don't remember any time that we had to tell patients, you must eat this amount of carbs, you must eat. What we would tell them is that, you should reduce the amount of rice you're eating or the amount of noodles, because here people eat noodles, not pasta or things like that. But I don't recall any time that we said, you must reach this amount, because that sounds really, strange and contrary to the idea of diabetes.
Well, you're right about that, and that's exactly how I feel. Not because I've studied under a bunch of professors, but because my blood sugar meter has told me that whenever I eat a lot of carbs, my blood sugar goes high, and when I eat a few carbs, it doesn't go high, and will usually stay fairly close to normal. So from a practical perspective, I've seen that in my own life. And now you're telling me that this professor under whom you have studied has basically said the same thing, and he's like one of the leading diabetes educators in the whole nation of China. Am I hearing you right?
Yes.
Wow. All right. Well, that's encouraging to me, that what I've discovered by practical experience, the doctors are saying in China. Sad that American doctors aren't getting that, although some are, and we thank God for those.
I think now the guidelines from the U.S., even the American Diabetes Association, is recognizing carbs as, limiting carbs as one of the ways to manage your blood sugar, your A1C. And it's probably the most effective way to manage your A1C.
Well, absolutely, that is true. And you're right. To be fair, the ADA has modified their stance. They were resistant for the longest time and just would not even recognize any kind of a low-carb approach to diabetes, but they are changing slowly. And some of the doctors have changed quickly, and others are still in the process or not even starting. Let's talk about something that I don't know if you're familiar with Dr. Jason Fung, but he's brought kind of a new paradigm to the field of diabetes, and that is that there is not only a problem with high glucose, which can be toxic to the body and very detrimental, but high insulin as well. And he has strongly emphasized the fact that when you're eating too many carbs, your insulin is going to be high if you produce insulin. Now, obviously, a type 1 wouldn't. But if your beta cells are fairly good, you're going to be running around through life with high insulin. Tell us, what's the problem with that? Why is high insulin a problem, and how can it be damaging to your body?
Yeah, I think what he's saying, like that, high amount of carbs or high amount of sugar in your blood can lead to high amount of insulin. That is true, because the way your beta cells produce insulin, it's not randomly. It's actually glucose that gets in the beta cells and to produce energy, to produce ATP. And that ATP can block some channels that at the end will lead to the beta cells releasing insulin. There are more steps in between, but the glucose actually gets inside the beta cells and force them to release insulin. So the amount of insulin that your body will release is dependent on the concentration of glucose that you have. So yeah, higher blood sugar leads to higher insulin. Now, insulin, because it's an anabolic hormone, that means it builds things, right? So insulin, when you have it high enough and you have enough nutrients, insulin can help you store them. This is one. Insulin can also help the body grow. That's why, like, if you are trying to do bodybuilding and you don't have insulin, it's very difficult, almost impossible, because you need insulin to build things in your body. And insulin can also promote proliferation. Quick division of cells. Let's say one cell divided to 2, to 4, and then 8, things like that. So that's why high levels of insulin have been linked to things like cancer, for example, because it promotes those divisions of cells. So if it happens to be a cancer cell, then it can cause some problems, right? And the other thing is insulin resistance. If you have high levels of insulin all the time, your body will start to resist insulin. And this is not just insulin. Anything that you have too much in your body for too long, the body will develop mechanism to resist it. Another thing about insulin, that some years ago people did not know, but now we know, is that because back some years ago when someone is getting fat, right, we thought that it was mostly because of fat, eating fat. But now we know that if you have high amount of insulin and the cells in your body have enough energy, the extra energy that are coming, insulin will help the conversion of those energy, of those glucose into triglycerides that will be later stored as fat. So having high levels of insulin in your body is not a good thing, especially if glucose is also high.
If someone becomes a type 1, one of the first things that happens to them, where they produce no insulin at all, is they lose weight. Whereas the typical type 2, where his beta cells are producing a lot of insulin, they tend to get heavier and heavier and heavier. So insulin plays a powerful role in either weight gain or weight loss, depending on the levels that are going on in your body. Is that right?
It's not just a powerful role. I think it's the most powerful role after the food you eat. Because obviously, as I told you, the beta cells will not release insulin by themselves unless you have, let's say, tumor of those cells, then maybe they will release too much. But the release of insulin is dependent it depends on what you eat. Then the main trigger of obesity, or maybe losing weight, gaining weight, losing weight, gaining weight, losing weight, is what you eat. But insulin serves as the traffic light. Serves as what will tell your body what to do at the moment when food comes. If we should store the food, or we have no food, no insulin, and the pancreas will produce another hormone, but maybe I don't know if we should get into that or not, that will go to your storage and start using them. But if you have insulin, every other aspect of using energy, using the storage energy that you have, will stop. The body will enter into a storage mode, using the energy that you are getting from the food and storing the extra. This is basically what will happen if you have insulin. Now, for patients with type 1 diabetes, because the immune cells destroy the beta cells by mistake, and they don't produce any insulin. So they lose weight quickly in a short amount of time. Because if you don't have insulin, even if you put glucose in your blood, the glucose is not going anywhere. Well, of course, it goes some cells, like, let's say, your brain cells. Your brain cells will not wait for your pancreas. They will just take glucose by themselves. But even other cells can do that. But the ones that we're talking about, like muscle cells, fat cells, and things like that, they need insulin to take that glucose. So you're just putting a lot of food, but we have no insulin to take that food to different cells. So your cells are still hungry, even though your belly is full. That's why you'll be shrinking until you go to the hospital or, pass out or something like that.
So let's talk about the kind of treatment a diabetic patient should ideally receive from their doctor or their endocrinologist. Let's say someone comes to you and he's overweight or she's overweight. Their A1C is 10 or 11. They're having frequent urination. They're constantly thirsty. They need help badly. Now, one of the complaints I hear from people that comment in my channel is all the doctors want to do is give you some pills or give you insulin, and they don't even approach the issue of diet. And, I've never been against taking medication if it's needed or insulin if it's needed, but I've always felt like, diet should be another approach. What would you do? Let's say someone comes to you, they're overweight, they've got high A1C and all these symptoms. What practical steps would you give them to try to help them get over all this?
Yeah, as you said about diet is not just one of the steps. It's the first step, diet and exercise. Those are the first step in the management of type 2 diabetes. And the second step is drugs that help the disease. There are drugs that help you with diabetes. There are drugs that make your situation worse, even though they control your glucose. Now, the ones that help you with diabetes, they are normally stopping you from eating too much or slowing down your digestive system that the sugar do not get into your blood at the same time, or they're making your kidneys excrete more glucose outside of the body. So these are the ones that will come second. And then the third is what, we say the other ones, like drugs that make your body release more insulin, or insulin, for example, or some other things. But the idea is, first, if you can do it just with diet and exercise, this is the first line. And then some drugs that help the disease itself, not just help your blood sugar. And then the third one is everything else that remains. And the fourth one is if you decide to do nothing and just, have a lot of complications down the line.
Which is the absolute worst. Doctor, let's talk about the increase of diabetes. I'm sure you would agree with me that diabetes has increased dramatically over the last 50 or 60 years. There are countries that saw relatively few cases of diabetes, and now it's an epidemic. And it's in America, but it's also in places like India, Africa. Why is that, doctor? Why is diabetes increasing so much in our world these days?
For me, I think the main reason is the food. What we're eating now and what people were eating before was different. This is one. And the second one is that lifestyle of modern people is different from back in the days. Now, first, for example, we didn't have all these, how do we call them? Fast carbs, processed food and food everywhere. That, I'll give you one example. If we went back like maybe hundreds of years before, if someone overeats in the morning, and maybe you go to the farm and you do a lot of stuff until evening, you come back to eat again. Now, if you do that, in the middle, somewhere, you will feel hungry and your blood sugar will go down. But your pancreas will release glucagon, is the opposite of insulin, that will go to your storage and start using the nutrients that you have to keep you going until when you find food and eat again. But now it doesn't happen. Now, this is very difficult to happen now. Like if you don't have enough food, you just call it. And after you eat, you don't do anything. So it's strange. If it's even not possible for people to not get sick with this lifestyle.
Yeah, it's, what you're describing, the idea of the fact that people might eat a breakfast, to go out and work hard all day long and not even eat another meal until they come home for dinner. It sounds a lot like what is commonly called these days intermittent fasting, where you skip meals, maybe you skip breakfast or you skip lunch, and you allow more time to elapse. You narrow your window of eating to where you're only eating for maybe 6 hours out of the day or 8 hours out of the day, and the rest of the time you're not eating. Are you familiar with the concept of intermittent fasting, and do you believe it's effective?
Oh, I've seen that some videos on intermittent fasting, but I never thought about it this way. Now that you said what I said, now it feels similar. Because I remember when I was young, because I'm from the village, the countryside, and that was the lifestyle there, But later I went to the city, and then things were a little bit different there. But then later I came to China, and it's even more different. So I suppose in countries like the US, it might even be more, people with food everywhere.
Yeah. Well, I can tell you that we eat more food, we eat more often, we eat higher carb food, we eat more sugar. I mean, it is the perfect storm that will create metabolic syndrome. So to me, it's not at all surprising that diabetes is increasing. And, sadly, we have exported our lifestyle all over the world, and I think more people are doing that. But as an endocrinologist, you're telling me that at least to where you have studied, they're getting some of these things and making proper recommendations. Are you seeing success with patients? Are you seeing people that have dropped several points in their A1C scores?
Yeah, a lot of patients do that. When I saw a video of yours when someone was saying that, he went to the doctor and the doctor was surprised that the A1C came down without medications. But that sounds strange because it's very normal to find, many patients that drop their A1C just with lifestyle, with eating. For example, let's say if you're in the beginning or middle stage of type 2 diabetes. Now, if you're at the end, that almost all your beta cells are destroyed, then you might need some help. That's another case. But for most people, especially if when you were diagnosed with diabetes, you were overweight, you had a lot of weight. That means your pancreas are still doing well because otherwise you would lose that weight quickly. Now, for those people, there are a lot of things they can do. Some will choose to just change their diet. Some will choose to just reduce the amount of food they're eating. Some will do exercise that can increase insulin sensitivity. Now, if your pancreas is okay, for many people, just increasing insulin sensitivity is enough, but not for everyone. But that's for another discussion. Now, you have a lot of options, and then you have medications, and then you have other things like insulin. So I don't think that an endocrinologist would be surprised if someone has high blood sugar and went back to normal. That's just saying that someone is obese and lost weight and you are surprised. But you might be surprised that they took the courage to do it. This is different. If it's this, then it's okay. You might be surprised someone that, I didn't think you'd do it, but you did it. Then this surprise is okay. But that I'm surprised that it was possible, then I don't think so.
Yeah, that's an interesting point. And we hear of doctors that will say to patients who've dropped their A1C by several points and got it down into the 5s when they were 8, 9, 10 or whatever, they will say, I wish more of my patients would take their diabetes seriously like you have. So I guess you're right. In some cases, the surprise is not that they can do it. The surprise is they did do it and they did take it seriously. So that's an interesting point. And the other point you made about people that are obese, really, it's in one sense, it's positive. It means their pancreas must still be producing quite a bit of insulin because if it had stopped producing insulin, they wouldn't really be obese. So that is one positive thing. If you're overweight, chances are your pancreas is working fairly well still, and there's hope for you. So I like that point. That's very interesting. Well, Doctor, I want to thank you for being on our program. I need to clarify something with our people. When I mentioned that it's 11 a.m. here and it's like 1 a.m. the next day there, they're going to think, Dennis, you are so cruel in demanding that this doctor stay up till 1 a.m. to talk to you on the phone. But this was actually your suggestion, and the reason is because you have a beautiful family, you have a lovely wife and 2 children, and you wanted to make sure those kiddos were asleep so you could do your interview in quiet. Am I right?
Yeah, they're sleeping now.
So people don't leave a nasty comment and ask me why I kept this doctor up so late. And I do need to mention that Dr. Vladmir has his own YouTube channel himself. He's just getting started with it. So I will leave a link to that channel in the description notes, and you can go to that and watch his videos. I assume you emphasize some of these very things that we've been talking about on your own YouTube channel. Is that right?
Yeah, I normally talk about my channel is small, just starting, but I'm planning to educate people a little bit more about, type 2 diabetes, because I feel like you can do more with education than just staying in the hospital, for example, and treating patients. Because if let's say you are in the hospital and you see 1 or 2 patients per, let's say, per 10 minutes or let's say 100 patients every day. It's still not enough. And the time you have will never be enough to explain to patients what type 2 diabetes really is so that they can get it and go home and start living a good life. So education is the most important thing for preventing type 2 diabetes and for the management of type 2 diabetes. That's why I was very happy to see your channel, because you educate people in a way that a lot of people can follow. And, as doctors, we can't do that. We might have a lot of, theory, or how you say it. We might know the mechanism of why things are happening. But for you to make someone to follow you with good example, with, practical things like you do on your channel is very difficult. So when I saw your channel, I was really happy, and God bless you.
Well, thank you, Doctor. You encourage me. You have freely commented, and your comments have been so positive, and I'm like, who is this doctor that seems to like me so much? And I had to get in touch with you, and it's a blessing to talk to you. Thank you for sharing with our viewers. Again, there will be a link to your YouTube channel down below. And may God continue to bless you. Are you planning to stay in China? Are you going to head back to Cape Verde eventually? Or what are your plans in terms of where you will settle for the rest of your life?
I think I'll go to Cape Verde. I don't know if it's after 1 or 2 years, but then I know that after some years I'll go.
All right. Very good. All right. Well, God bless you, Dr. Vladmir, and continue to use you to help diabetics.